Dear customers, it is with great sadness that we inform you that the Ministry of Health has announced that unfortunately, another Cambodian citizen has tragically died from the H5N1 bird flu. According to the press release regarding the death from bird flu of a 3-year-old child, the ministry expressed its deepest regret and extends its sincere condolences to the parents, family, and loved ones for the heartfelt loss of the 3-year-old child during this difficult time. The 3-year-old child, residing in Prek Village, Baslev Commune, Chitbori District, Kratie Province, died from bird flu on March 23, 2025. Despite the efforts of the specialized medical team at the hospital, they were unable to save the child. The national and sub-national emergency response teams of the Ministry of Health have been and are continuing to collaborate with the working groups of the Provincial Department of Agriculture and local authorities at all levels. They are actively investigating, monitoring, and researching at the incident site by taking samples from people who had contact with the patient and continue to search for suspected cases and contacts to prevent the spread to others in the community. They have also provided immediate preventive treatment with antiviral drugs to close contacts and are conducting educational campaigns to inform the residents in the village where the incident occurred to prevent the spread of bird flu. The Ministry of Health also wishes to remind all citizens once again to remain vigilant and cautious about bird flu at all times, as bird flu H5N1 continues to pose a threat to the health of our citizens. Additionally, they advise that if you experience symptoms such as fever, runny nose, or difficulty breathing, and have a history of contact with sick or dead poultry within the 14 days prior to the onset of symptoms, please avoid gatherings. Gatherings with many people should seek consultation and treatment at the nearest available health center or hospital immediately and without hesitation to avoid delays and reduce the significantly high risk of death. If you have any questions related to health issues, the avian flu, or any other health-related concerns, please call the Ministry of Health's hotline at number 115, free of charge.
I would like to connect or set a specific time. Please continue with the case of a 3-year-old child, 6 months or 3 years and 6 months this November. Their family raises chickens, and about 5 chickens died earlier, with some others currently sick. The family members did not dispose of them properly, but instead used them for cooking. Cooking is the case in Prektam Village, Baslev Commune, Chitbori District, Kratie Province. At that time, the bones were not buried or burned, but instead, the dead chickens were commonly used for cooking. This case involves dead and sick chickens, and the family of the patient used them for cooking. Therefore, in this case, I want to remind the citizens, especially to the citizens who raise chickens as a family practice and often think that their chickens do not affect anyone. But we know that when the chickens leave the house, they play a role. And again, the issue of illness arises. Please, our fellow citizens, we kindly ask. Be careful in this regard. The word regret and the idea that you are only raising them yourself and not bringing them from anywhere else. It is a danger. In this case, we can consider it as an experience, a lesson. One must be cautious, especially those who raise chickens and ducks that get sick and die, and then use them for cooking. This case has already occurred, so please be careful, especially those who raise chickens and ducks as a family practice or as a farm. Especially for those who raise them as a family and often say that they are natural chickens or free-range chickens, etc. While it may seem that there is no other impact, typically they go out and come back. Do we know where they have been? Therefore, please increase caution in this matter as well.